Everybody, we're going to talk today a little bit about the corporate compliance plan and program for PSCH and how our department, Health Information Management, plays a significant role. As you all know, it's very important that all state-funded agencies follow the regulations of New York State. In order to receive money and funding from Medicare and Medicaid, all of our records have to be in compliance of all of the regulations that are out there. Basically, this department has to implement procedures that must be followed in order to ensure that the records are 100% accurate. Question number one, I would ask, what is corporate compliance? And I'm going to quote a statement that I read on hcpro.com, which you guys can all go to and read it. And basically they explain corporate compliance plan is the tool, expert guidance, and education to help healthcare compliance and audit professionals help their organizations in compliance with federal and state law and regulations. Practical strategies to ensure appropriate reimbursement and prevent violations of the False Claims Act, Stark Law, HIPAA, and anti-kickback statute. Now, we've all discussed every one of those policies many times, and you could all see them in full at the PSCH website, psch.org, or on any of the regulatory agency websites. And in order to work at PSCH, you have to read them, you have to sign off on them, and you have to understand them. Now, how does HIM help PSCH comply with all of these regulations? What we have to do is follow those procedures that I was talking about. And those procedures start with how the records walk in the door and how they're stored and what we do before we store them. So basically, in the past year, as an HIM manager, I have taken the role to implement procedures to make sure everything that gets on the shelf meets all those regulations before we store them, as opposed to when an auditor calls us to look at those records to ensure that we provided the services that we're looking to get paid for and then find mistakes. Because, as we also know, they can look back 6 years. So if the doctor was with us 6 years ago and provided a service but forgot to sign his document, it's null and void and we have to pay back. And not only for that service, but for all the other services that were provided that we cannot prove we have documentation for. So anyhow, basically, here in our department, prior to the procedures or continually, what I need to do to make sure everyone here understands what the regulations are, because they continually get changed, I take it upon myself to do all of the webinars and trainings that are offered by all the regulatory agencies. Sometimes we do them as a group, sometimes I do them, and then I provide training to you so that at the end of the day, you know what you're looking for when you're reviewing those records. You know what the auditors are looking for when they review them. If there's problems, we are very proactive. We reach out to the programs and have them fix those deficiencies straight away, as opposed to when we might not be able to. As well as training you, as the HIM manager, it's my job to train all the managers, because they have to then train their staff. But with my role, it's my job to know what the latest up-to-date regulations are and then to share them with the organization to maintain corporate compliance throughout. Okay, procedure number one, as far as the records are received and being able to return them or respond to requests in a timely fashion. The most important thing that we do is, number one, we take the records in, we review them, we make sure they're right. We store them, but if you could actually, Gina, if you could just take a view of what I'm talking about, you could get a little bit of an understanding of how many records can be maintained in one building. So just because I reviewed the record that might be in one of these boxes doesn't mean I'm going to be able to find it unless there's a procedure in place to make that happen. And that could be done in many ways. Here we do it through a program called OnBase, where we designate a location, and at that point we input it into the computer where the record is located in the facility, and then we're able to find it and retrieve it in a very timely fashion, whether it be for audit, whether it be for services, whatever it may be. Now, say that there is an audit at a program. HIM assists in every way. We will immediately respond to the request for records, and we will go out to the program and we will assist them in finding what they're looking for within the record. Continually, we will continue to make sure that every corporate compliance reg is ingrained in every staff member of PSCH in order to ensure that we are always in compliance, because that is how we make our money. And as much as we're here to provide services for consumers, without salaries, we can't afford to do what we need to do for them. So, just as a reminder and a recap, that if you want to look at our corporate compliance plan, it's a 71-page document, and it can be found at psch.org, as well as every one of the regulatory agencies that we receive trainings from: AHIMA, DOH, CMS, OPWDD. They all have their regulatory rules on their websites and can be found at any one of those names.org. So if anyone has any questions, I'd be more than happy to answer them. If not, thank you very much.